what it indicates is the increased concentration of urine and decrease in dilute urine. So that was urine analysis. The next test is blood urea nitrogen, or in short BUN. Urea or BUN is a nitrogen containing compound formed in the liver as the end product of protein metabolism and the urea cycle. About 85% of urea is eliminated through the kidneys, whereas the rest is excreted through the gastrointestinal tract. Serum urea levels increase in conditions where renal clearance decreases, such as acute or chronic renal failure or impairment. Urea may be decreased in starvation, low protein diet, and severe liver disease. Serum creatinine is a more accurate assessment of renal function compared to urea. However, urea is increased earlier in renal disease. Urea may also increase in other conditions not related to renal disease, such as upper gastrointestinal bleeding, dehydration, catabolic states, and high protein diet. So here I have read already blood urea nitrogen test. It is basically a nitrogenous containing compound that is formed in liver at the end product of protein metabolism and the urea cycle. So at the end of protein metabolism, it is the last product, nitrogen containing compound called blood urea nitrogen. Now 85% of urea is always eliminated through kidney, and the rest is extracted through GI tract. Now serum urea levels, they increase when renal clearance decreases. Basically they are telling kidneys, if they don't eliminate urea, then serum urea level increase. Acute means for less time and chronic means for a longer time. Urea may be decreased in starvation. So when someone is starving, low protein diet and liver disease, the urea may come very decreased, low level. Serum creatinine is a more accurate assessment of renal function compared to urea. So urea is increased earlier in renal disease, so it is a good parameter for detecting a disease of kidney. Urea may also increase in other conditions that are not related to renal disease. That can be gastrointestinal bleeding, that can be dehydration, that can be high protein diets, etc. So this is all about blood urea nitrogen or BUN. Now what are the indications? Here in this slide we have stages of chronic kidney disease, that is stage 1, stage 2, stage 3, stage 4, stage 5. You can see in stage 1 the kidney looks healthy, and in stage 5 the kidney looks like it is smaller in size and it's almost unhealthy. So here we are talking about the indications. We mean by that is something that can assess renal functions, and it can tell about if this is an emergency situation, or it can be treated, or it is chronic or acute. Indication for assessing renal function vary, ranging from acute emergency to chronic settings. Primarily, renal function tests are performed to identify renal disease, determine appropriate patient management, and prevent further deterioration of renal function. So, further indications in patient in whom renal disease has been identified are to stage the level of type of renal disease, monitor the progression of renal disease to ensure optimal management occurs timelessly, and monitor response to interventions. In other scenarios, renal function tests may be required to establish and monitor renal function where a known or possibly nephrotoxic therapeutic agent is initiated for patient management. Renal function tests are also indicated in those who are transplant donors to assess the initial donor suitability, and after that to detect any significant deterioration of renal function post donation. Renal function test can also be used to identify which area or functional unit of kidney, that is nephron, is affected. For example, glomerular versus tubular disease. Here in all these steps I am this is telling you that how the test I have explained above have can indicate what kind of emergency situation or what kind of situation a patient is. If he is in stage 1, he can be called acute renal function disorder. If he is or she is in chronic setting, then it can be called stage 3 or stage 4 problem. And if treatment is already going on, then there can be anything. So all these indications just help the doctor to give proper treatment therapy and safe and effective use of drugs. Next up is clinical significance. Clinical significance are of can be of creatinine and blood urea nitrogen. We already know about serum creatinine and blood urea nitrogen test. So serum creatinine levels are elevated when glomerular filtration rate, that is GFR, significantly reduces, or when urine elimination is obstructed. About 50% of kidney function must be lost before a rise in serum creatinine can be detected. Thus, serum creatinine is a late marker of acute kidney injury. This limitation is why other substances that may be elevated earlier in the disease process are being studied as markers for kidney disease. So, serum creatinine is a late marker for acute kidney injury. When 50% of kidney function is lost, then only serum creatinine is increased. Blood urea nitrogen or serum urea levels increase in acute and chronic renal disease. Equations for eGFR are used to determine the presence of renal disease and the stage of CKD and to monitor response to treatment. CKD, we already know, is chronic kidney disease. eGFR is estimated glomerular filtration rate. BUN is blood urea nitrogen. So serum urea can be used to detect acute and or chronic renal disease, and also to monitor the response of the treatment of CKD. Next slide is patient safety and education. For GFR measurement using radioactive isotopes, patients should be advised regarding the small amount of ionizing radiation involved and the need to exclude pregnancy in any female of childbearing age before the test. In general, patients undergoing blood draws should be advised regarding potential issues of bruising and pain. 24-hour urine collection bottles may contain small amounts of preservatives such as thymol, and direct contact with skin and mucous membrane must be avoided. Collection bottles must be kept out of reach of small children who may accidentally ingest the preservative contained inside.